Well, according to the Centers for Disease Control and Prevention, about 115 Americans die every day from opioid overdoses. In 2016, right here in South Florida, almost 1,700 people died after using drugs like heroin or fentanyl, which is 100 times more powerful than morphine. For years, police would arrest drug abusers who would only go back out into the community and use again. But a new pilot program in the city of Miami aims to break that cycle. Last week, the Miami Police Department received a $1.6 million grant from the Justice Department to fund a program called the Collaborative Law Enforcement Addiction Recovery Program, or CLEAR. It partners police with the South Florida Behavioral Health Network, the University of Miami Health System, and other agencies to give those found with small amounts of opioids a chance between either going to jail or a one-year outpatient treatment program. Miami Police Chief Jorge Colina spoke to us about the program and how he thinks this could be the beginning to bringing an end to the opioid crisis.
Traditionally, we come across an addict, and what we do in law enforcement is we put that person in jail because that's the tool that we have, and they are breaking the law by using an opioid, be it heroin, fentanyl, whatever the case might be. We know that that doesn't work because we have people that will literally overdose, be brought back to life, and will continue to use drugs. And so this is definitely a law enforcement problem, but there really isn't a law enforcement solution. So what we want to do is have that addict enter into an agreement with us where essentially we're providing care before we're providing the cuffs. This program can be a big game changer for us. I'm going to provide the officers and the training. M.P.H is going to provide the medical professionals that can oversee the program. While they're under the care of M.P.H, they're also being treated with whatever else they may have. So if they're positive for hepatitis, for example, they're going to receive treatment as well. And so this is another mechanism where the whole community benefits because you're also stopping the spread of disease. What we're hoping is that by being treated by medical doctors, they have a much better chance of fighting their addiction. They'll be monitored through the withdrawal process, being given medication, receiving treatment, and then towards the end of the program, additional social services that will come in to help them transition to being a productive citizen, which is what we all want. We hope this becomes a model for others to follow. We're hoping in the future private dollars will come in to help grow the program, and we're quite excited about it, to be honest.
And joining me now to break down the medical services part of the CLEAR pilot program and what it offers to addicts are two of the program's partners, University of Miami Health System's Dr. Hansel, founder and medical director of the Idea Exchange, and Laura Naredo, Chief Operating Officer of the South Florida Behavioral Health Network. Thank you so much for being here, to both of you.
Thank you.
Thanks for having us.
I love what the chief said, care before the cuffs. That's really important. So Dr. Tukes, break it down for us. You were there when the chief made the public announcement about this pilot program and what that was going to mean for the community. You're a part of all of this. How did you feel that something like this was finally coming to fruition?
I mean, I got chills when he made his announcement.
Yeah.
I got chills just watching that package. What I don't think that Miami realizes how revolutionary this is. We're actually partnering, health professionals, we're partnering with law enforcement to offer a solution to people who are affected by opioid use disorders. I mean, this is an amazing opportunity for these people. It is so hard to get into treatment in Miami. It's so hard to get treatment for hepatitis C, for HIV. This program is comprehensive in its aim. So people are going to have peers that are going to help them along the process. They're going to help link them to outpatient medical assisted treatment, things like Suboxone or Vivitrol, and they're also going to link them to primary care health services. This is really going to improve the health of the entire Miami community.
So Laura, let's talk about that for a moment, because again, arresting people who have an addiction to drugs is not a way to solve their problem. They really need help. They need medical help, they need mental care. So tell us what happens. Somebody gets arrested and they say, yes, I would like to go into treatment. So what happens from there?
So hopefully, like you saw in the package and like how Dr. Tukes just spoke, hopefully they won't get arrested. Hopefully they'll get diverted into care. And that's hopefully one of the great outcomes we'll have with one of these programs. So there is more need in our community. about 28% of the people that actually need care actually make it into our public system.
Only 28%?
Only 28%.
Wow.
We have much more need in our community than we have capacity for care. On any given month, we run up between a 500 to 700 person wait list to access residential services in our community. There is much more need in our community. I know we're focused in this program specific to opioid and opioid diversion. However, that's speaking to alcoholism, that's speaking to cocaine use, marijuana use, everything across the behavioral health, substance use, addictive, different disorders. So hopefully with this new program, what we'll be able to do, if the police does come across someone that meets this criteria that traditionally they would have arrested and put into the jail and not necessarily gotten treatment, we can divert and engage early. And with partners like Jackson, get them into medical care, get them induced on any kind of medication-assisted treatment like Suboxone or Vivitrol or any of those kinds of medications that will help in care. If outpatient care is the level of treatment that the person can best benefit from, get them into outpatient care. And then if not, residential care is available in our community as well. But like I mentioned, does run a wait list and makes it very difficult to get into care in our community.
So, but this pilot program, there's money dedicated toward this, 1.6 million, like we said. So
Absolutely.
Are they going to be able to get into a program, or are they going to have to get on a wait list?
I think it'll be a combination of what level of service. If it's outpatient services, I think they'll be able to get in through with the pilot program right into medication-assisted treatment and into outpatient services. The program currently does not cover residential care, so if that level of care is potentially needed, then we'll have to work with the program to make sure that these people are getting priority and access into care.
And you were saying there are folks who do have priority, if you're a pregnant woman, for example, right? Who else might have priority, Dr. Tukes?
Patients with HIV, pregnant women, people who inject drugs, all of the high-risk populations are priorities for residential treatment. But what's so amazing about this program is instead of getting arrested, they take you to Jackson Memorial Hospital to have an evaluation by a physician, which is really where you need to go if you're using opioids. You get an evaluation, and then you come up with a treatment plan with the physician. That treatment plan could include inpatient detox. It could include medications to go home and detox yourself. And then there's a recommendation for what kind of treatment plan you're going to have based on how severe your disease is. And the really key part of everything is that there are peers that are going to be hired by Jackson Memorial Hospital to help these people along the process. So these are people who used to also use opioids, who are going to be there to support, guide, and provide reinforcement the whole way through the process.
And so what is your hope for this program? I know we were talking earlier, you said that this is something that you and some of your colleagues have been talking about for several years, that there needed to be something in place. So do you think this is really going to make a big difference in stemming the tide of what we've seen with just this rampant opioid addiction?
So Executive Officer Diaz, I believe, conceived of this with the support of Chief Colina. This is revolutionary for Miami. I think that when we got needle exchange, of course, it was a very big deal in terms of preventing disease. But this program will also prevent disease because it's going to help people get the treatment that they need for HIV and hepatitis C. Everybody who goes into the program is going to get naloxone, so we're going to see a continued decrease in our overdose rates. This is going to be an amazing thing for the community. We're going to get people shelter. We're going to help, in the long term, get them jobs, and I really think that we're going to turn the tide of the opioid epidemic.
Talk about, for a moment, the homeless population. Are they going to have the opportunity, because I was reading that there wasn't money necessarily in this pilot program to get them into a place to stay. Is that what's going to happen with them if they're a homeless person who is the police find you, arrest you, or maybe they don't arrest you, but they say, hey, you either have to go into this program or you're going to go to jail, but they don't have a place to stay, I guess is my point. So what happens to them?
I think that's still a challenge for our community. Like I was mentioning, just on the treatment side, we have more need than capacity. We have more need than capacity on our homeless continuum as well. So we definitely need to continue to partner in the work that we've been doing the last several years to continue to partner, engage with all our system partners. And that's part of what this is so revolutionary, because we've engaged treatment, we've engaged the hospital system, we've engaged law enforcement. We need to continue to engage the homeless system to ensure that we're all partnering to meet the needs of our community. And I think it's big steps we've taken the last several years. We still need to go much further in that process. And this grant is an opportunity to continue that partnership and that work.
The Homeless Trust needs to step up and provide beds for these people.
Okay.
We need to lower barriers.
But they're not partnered with you at this point.
They are partners.
They are partnered. That's what I thought. Okay, but you're
Right.
saying they just need to step up and offer more beds.
The thing about everything with care for this population is there have to be low barriers. When we get people into HIV care with the health department, we knocked out all the barriers to make it
Okay.
easy for people.
No red tape is what you're saying.
No
Just-
red tape.
Just go right to getting treatment.
All of the stakeholders and partners in this program need to understand that there's a major problem getting into treatment, and we all need to lower the barriers to get people housing and to get people into outpatient treatment. Everybody has to work together, and we have to change the way the system works.
Do you think there could be a public-private partnership going forward if people in the community start to see that this program is really working? Because it sounds like, too, we need more funding.
Absolutely. I think it's an opportunity for a public-private partnership to continue the work and continue funding, because there is more need than capacity in our system. And the more partners that are working together, the lower those thresholds are going to get and the more people that we can get into service.
So the program kicks off May of 2019. So what happens in the interim here?
So we're planning the evaluation,
Yeah.
we're planning the implementation. We'll continue. This program was conceived by Post-it notes across a very long wall. And we
That's how some of the greatest things start, right, Dr. Tukes? Post-it notes everywhere.
So we'll have to do the same thing to work where all of the barriers are going to be in the process, and we have to work to eliminate those barriers. But now we finally have everybody in the room together, and I'm very confident that this is going to happen. The mayor wants it to happen, the chief wants it to happen, and the medical community wants it to happen. So.
And it could be a great example to the rest of the nation, too, right?
It would be very nice to see Miami lead the nation with a positive program for drug use.
So for people watching this, they're not addicted to drugs, or it's one of those where they just say, man, that's really not in my wheelhouse, or what do they need to know about this? Why does everybody in the community really need to care about this problem?
So it's like the chief said. So using drugs is a law enforcement problem, but there's actually not a law enforcement solution. Arresting these people and throwing them into jail is not the solution. All that happens is they come out of jail and they use again, and their body's not used to it, and they overdose and die. This actually addresses the issue exactly where it is. It's the repeated behavior of drug use, and we give people the support to actually make a change. When people are in the hospital, when people are arrested, when people are overdosed, those are the times to actually try to intervene and make a change in their behavior. So this is an incredible opportunity for all the people who will be in the program.
Yeah. Thank you guys so much for being here. I really appreciate it. Best of luck with the program. Just, you have to come back and keep us posted on how it's going.
You know
I know
I
you
will.
will. Love having Dr. Tukes back to visit us. All right, well, do you have a comment or a question about the CLEAR program? We want to hear from you. Send us your take on this or any other topic on today's show. You can always reach us via email or post a comment or a video to our Twitter or Facebook page @YourSouthFL. As always, we look forward to hearing from you.